Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
How much should a dental hygienist produce per day or per hour? And are you in many cases potentially undercharging for hygiene without even realizing it? These are the kind of questions we get all the time from doctor owners, office managers, and even hygienists themselves. So to answer these, I thought for this week's episode, I'd bring on and interview Sabri Blumberg. Now, if you've been listening to the podcast for a while, you'll be very familiar with Sabri. She's the Deputy Chief Operating Officer here at MGE. She's our senior technical authority. She's worked with thousands of practices, trained tons of staff, office managers, hygienists, and built multi-million-dollar hygiene departments from the ground up. We're also, as you can see, we have the same last name, so we're married, so I have to get this interview right, folks. We've worked together for 30 years, and I don't want to get in trouble. So with that, let me welcome Sabri on the show. Sabri, welcome.
Hi, Joe.
Okay, so for this week's episode, we're going to tackle the most common and important questions surrounding hygiene, your overall hygiene department,
Yes.
right? So rather than read the questions and then ask you the questions, I figure we should just go through them, right? But I really think, looking at what you're going to cover, because I know what you're going to cover ahead of time. Well, not what you're going to say, but I know the questions I'm going to ask. I think this is one of those episodes that could change the way that people think about their hygiene department. So I think for whether they're a doctor, office manager, or hygienist, it's something they're not going to want to miss.
Okay.
All right, cool. All right, so I think we just jump into it.
Sounds good.
Make it pretty A to B here, right?
Yep.
All right, so first question. How much should a hygienist produce per day or per hour?
Okay, so that one is kind of modified by where the practice is located.
So for like fees.
Fees,
Okay.
yeah. Obviously, like fees in Beverly Hills are going to be different than fees in Arkansas.
Sure.
Right? So a little bit modified by fees, but the national average for a 100% PPO practice is between $1,200 and $1,500 per day.
Okay.
So that boils down to anywhere between $150 and $187 an hour.
Okay, so if this office is 100% PPO,
Yeah.
so they're taking reduced fees, sometimes a 50% haircut in certain cases.
Yes.
They should be averaging 150 to 187, you said?
Correct. And I'm not even saying that's what they should be doing. I'm saying that's the national
That's the average. So 12 to 1,500 a day.
Right, but a lot of practices I see are not even meeting the national average because of different reasons.
Okay, and what about if they have zero PPOs? They're just 100% private.
Okay, so now the fees totally change.
And I know they'll vary.
Yeah, but on just a regular, normal 8-hour day, the national average is anywhere between $2,000 to $2,500 a day.
Okay.
But I've seen practices do $3,500 a day.
Wow.
Depending on their fees and their perio philosophy and what the hygienist is doing.
Okay.
Right? Like very often we have hygienists that are not using all of their skills, right, that they can be doing. So it really depends. But on a national average basis, it boils down to roughly anywhere between $250 and $312 an hour.
That's for a private practice.
For private practice,
Got
private
it.
fees.
So you're saying you're seeing a lot of clients, and they're 100% PPO, and they're not meeting this 12 to 1,500 per day.
No.
Or if they're private, which, most clients coming in new have some degree of network participation.
Correct. Usually the average is about 70% PPO.
And that makes sense. But so you're seeing that, and they're not meeting the 12 to 1,500 or the 2 to 2,500 if they're 100% private.
Correct.
So why?
There's different reasons. It could be, first of all, cancellations.
Sure.
Right? Seeing way too many, which is easily fixed with a good cancellation policy and getting that actually applied and implemented into practice.
Right.
Could be that their hygiene just isn't maximized and there's openings because they don't have good reactivation or recall protocols.
Mm-hmm.
So the hygienist is not seeing as many patients as she could be seeing or he could be seeing in a day.
Okay, so basically, like we talked about confirmation process on the podcast a few weeks ago.
Yes.
So their confirmation process is garbage, and they have a bunch of openings.
Yes.
So obviously, that's going to affect overall productivity.
Yes.
Or when you say they're not maximized, you mean like they're getting too much time for an appointment or more time than they need?
Yeah, it could be different things. Could be, when I said maximize, that is one of the reasons. What I meant when I said maximize, meaning that their patients, their current patients are not hygiene compliant.
I see.
So they have openings in their hygiene schedule that just never got filled.
So it's not even a matter of cancellations. They're just not filling.
They're just not
It's
filled.
just a big old gaping hole in the schedule.
That's exactly
Got it.
right.
Okay.
But you brought up a really good point, and that is that, in certain
But
practices.
you have that recorded on record, folks. I brought up a good point.
You brought up a really good point, and I wouldn't have even thought about
This is
bringing
now
it up.
recorded for posterity.
Whatever, man.
2,000 years from now, archaeologists will find this. Anyway, go ahead. Jeff brought up a
Okay,
good point. Go
the
ahead.
good point you brought up is very often there's like a roboticness to scheduling hygiene. So everybody gets an hour,
Okay.
right? Regardless of how many teeth this person has or the age of that person.
Okay.
Right? So, people who are younger, right?
It's
or
like a kid's
children,
cleaning. Yeah.
Yeah, you shouldn't be scheduling an hour for that.
More like 40 minutes, maybe.
Right. If somebody doesn't have all their teeth, only has a few teeth left, yeah, they're still getting cleanings, but why are you scheduling an hour for that?
Right.
So scheduling the patient according to the needs of that particular patient allows you to see more patients in a day.
Okay.
And that can affect it as well.
Okay.
Right.
And one thing I've seen you correct, you've pointed out and the clients have corrected it, but is you'll have a patient or rather a hygienist is seeing a patient, and it really is a gross debridement,
Yes.
but they're just going to do a good cleaning. And this is I've seen you do this with a few clients, and this seems to be a real problem.
This is actually the biggest reason why people are not producing what they need to be producing in hygiene.
Okay.
Is if I'm seeing, like, let's assume that the factors that we talked about earlier, like we're scheduling them properly, it's confirmed properly,
Sure.
patients are showing up. So I have a full schedule, and you're still not meeting those numbers. Then what is happening? Well, very often when I look at those schedules and I look at those charges, every single patient is charged out like a pro fee.
I see.
Right, and that is even new patients, and that is simply not reasonable. That nobody in that practice has periodontal disease.
I see.
Right, so what that means is one of two things: either they're seeing the periodontal disease, and they're just ignoring it and doing cleanings, which is not very common.
Okay.
Right, I don't actually remember the last time that I saw that.
I mean, I can think of one example, but we don't. Yeah.
Yeah, that's rare.
Yeah.
But it's far more common is they're treating the disease, they're doing limited scalings, they're doing gross debridements, they're doing everything that the patient needs, but they're charging it out as cleanings because they cannot have that financial conversation.
I see. So
with the patient.
just to clarify, so patient really needs some type of mild perio treatment, some
Yes.
type of mild periodontal therapy.
Yeah.
And no one's talking to the patient.
Nope.
And instead they're just charging out as a pro fee.
That's correct. We're just doing pro fees, right?
see.
But we're doing much more than pro
But we're
fees.
really doing a gross debridement or mild scaling.
Correct. We're just not charging for it.
I see.
And that creates two problems. First of all, we're not, the hygienist is not producing what, or not getting to count of production of what they're really producing.
Yeah, they're actually producing
They
it.
are
They're just not
producing
counting
it.
it.
That's correct. So
Yeah.
they don't get to count it. But at the same time, the patient is unaware of the condition that they're in. So certain habits that the patient has creates the condition, the periodontal condition.
Sure.
Right? Either not flossing properly or maybe not sticking to their cleaning schedule the way that they should be or not brushing properly or whatever. The patient has certain habits that are creating the condition that they have. Right? And we are not addressing those issues with the patient, and there is no consequence for the patient. So even if we bring it up, like, hey, you really need to floss a little bit better, or this, or
Yeah, what
maybe
difference does it
brush.
make? You're just going to clean my teeth again.
That's correct.
They don't
There's-
realize that they've got a bigger problem now that they really have to address.
Yeah, they have no idea that that habit that they have has a consequence because there is no consequence to the patient. There's only consequence to the practice.
Okay.
Right? And my philosophy has always been, right, inform the patient like, hey, listen, this is the condition that you have on these 3 teeth. We're going to have to do limited scaling because you have tartar on the gum, and
Right.
explain to them what's going on. And this is how that happened. Right. And so what we're going to do today is we're going to explain to you exactly how it happened and what you need to be doing at home so that this doesn't happen to you anymore, and the schedule that you need to maintain. And at the same time, what we're going to do is we're going to take care of this today. It is going to be a little bit of an extra charge because it isn't a normal cleaning today. But if we take care of it today and then we change your home habits, right, hopefully we won't have to do this again in the future. Like that, the patient is aware that the way that they are treating their gums and teeth is creating a non-optimum condition. There's a consequence, they have to pay for it. but it also changes the habit so that the patient does not have to go through this again in the future, hopefully.
Which brings up a follow-up question.
Yes.
Because this is interesting that you mentioned this.
Yeah.
So what percentage of the time, because you talk to clients all the time, especially
Sure.
newer clients, do you see this as a problem where the hygienist is really doing some type of scaling?
Yeah.
Or even like maybe not a heavy duty 4 quads, a quad an hour type scaling, because that obviously is too painful to be ignored.
Sure.
But just from a time perspective, but something that should have been a scaling or a gross debridement or something and charging out as a pro fee. How often is that happening?
I would say I see that 80% of the time.
Wow.
I see that a lot. And the reason why I see that a lot is because of these insurances, right? So what insurance doesn't cover, now there's a copay.
I see.
Right? So who is going to have that conversation? But especially if it's just like a limited scaling or something like that, or it's a gross debridement.
Yeah.
Right? It's not obviously periodontal disease. We're going to do 4 quads of scaling and root planing. That I
Right.
see, like that usually just happens.
Okay.
Right? But it's those other things that hygienists are doing that they should be charging for. I would say 80% of the time they're not.
Got it.
Right? And that boils down to a couple of problems. Why is that occurring? Right? Well, there's no policy.
That was going to be my next question, because
Yeah.
I know you have a sample, which
Yeah.
I'll talk about here in a second, that
Yeah.
you brought with you today. But how often, again, because you're interviewing these newer clients, do they have some type of policy indicating diagnostic criteria
Oh, I don't remember the last time I saw that.
for periodontal?
For periodontal, and what I'm talking about is like very specific. If this is the condition, this is how we diagnose it. This is how we charge it. This is the treatment for it. This
How
is the
long it takes, the
schedule that the
appointments.
patient's on, right? And by just putting policy in place, it takes it out of the hand of the hygienist. It makes actually the conversation easier for the hygienist to have. Like, I'm very sorry you fall within this category. I cannot do a regular cleaning. I must charge for it.
So then basically, not to cut you off, but so what you're saying is, I'm the hygienist, I have a policy.
Yeah.
So I'm in there doing my thing as I get started with the patient, and obviously, like, oh my gosh, this looks like it's going to be type X, periodontal, whatever.
Sure.
So then I'm calling the doctor over to diagnose it.
Obviously.
But this is based off the doctor's diagnostic criteria in policy.
Correct. The
Got it.
policy comes from the doctor.
And the
Now,
doctor has
obviously,
to
the doctor
confirm the
needs to confirm the
diagnosis, yeah.
diagnosis, right? But there's no reason why the hygienist can't talk to the patient about it while they're waiting for the doctors to come in and confirm the diagnosis.
Right.
Right. So,
Actually,
and if on top of that, you've role played with the hygienist on how to have that conversation with patients so that they're comfortable talking to patients about it and they're comfortable answering the patient's questions. And organizationally, you set up so that if there is an extra charge, it's not up to the hygienist to handle that, because that is
Right.
not their role in your practice.
well, it's interesting you're saying this, because if you think about the way that any business should work, really, right?
Yes.
If you have set policy on, if it's this, it's this.
Mm-hmm.
If this happens, this happens. If this is how we determine we're going to do X,
Yes.
right? So in this case, you're not only having the doctor create their own, which we have a sample of one of these you brought, which
Yes.
we have as a free download on the episode webpage, which
Yes.
is awesome, and you can use it to kind of craft your own.
Everybody's going to have different criteria because everybody
Right.
has their own
This
diagnostic.
is a complete sample. It has
and-
one of those nasty
yeah.
disclaimers at the beginning. 'Cause
Yes.
we're not doctors. We're not
No.
giving you you have to, but it's giving you an idea, guidelines, right? What should be in there.
It makes it easier to customize for you.
Right. You're creating something for yourself with something to use as a basis.
Okay.
So the doctor's written a policy. This is my policy on what constitutes various forms of periodontal therapy.
Sure.
So then it's not just a matter of the doctor's written the policy. Then when you hire a hygienist, you have to A, go over it with the hygienist, and B, make sure that they buy into it, because you don't want a hygienist going, well, yeah, I don't agree with that,
No, of course.
because then you're going to have problems. So if the doctor and the hygienist are on the same page with this, and there's very clear-cut diagnostic criteria,
Yeah.
then life becomes really easy.
It really does. And
Yeah.
that's when you start seeing these numbers start coming up. It's not that anything changes.
Yeah,
It's just we're charging for it now.
right.
That's really all. And it's not just good for the practice, good for the patient. The patient's home care will improve.
Yeah, that makes sense. Well, yeah, you're right, because now they realize, like, oops.
I don't want to do that again.
Right.
Right.
That makes sense. And it's a
Yeah.
more real representation of what's going on.
Exactly.
That makes sense.
Exactly.
Okay, good. So that's how much they should produce per day per hour and why.
Yes.
Now, this is a question that we get a lot, but I guess it's really variable. How many patients should they see in a day?
So on a normal 8-hour day, you would expect them to see at least one patient an hour. Now,
Sure.
as I brought up before when we were talking about, like, you bring up a good point, Jeff, right?
Oh, yeah, we recorded that for history. Remember that?
Yes,
folks?
remember that one.
Yes.
You don't want to get too robotic about that,
Okay.
right? So you do want a little bit of policy on and on how long to schedule that particular patient for. And what I have seen, and I saw it in a couple of practices, this is not my idea. I saw other people doing this, and I thought it was so smart. What this doctor was doing is usually when we train a new front desk person, the doctor will indicate how much time they need for that patient.
Okay.
Right? In dentistry.
Sure.
Right? Well, this particular doctor had their hygienist do the exact same thing.
Oh, interesting.
This is how much time I need for this patient. And very often it was less time. And because they were scheduled on 10-minute intervals instead of 15-minute intervals on their schedule,
Right.
like we recommend 10-minute intervals, it made that hygienist super productive, and that hygienist was using their time correctly. Now, they had enough time to turn over their room, they had enough time to set up for the next patient, but they weren't like sitting around because, they got an hour for a kid.
Right. Yeah, makes sense. Okay, good. So that's how many.
Yeah.
Obviously, if it's a 4-hour day, they'd see maybe 4 patients.
Yeah.
And 3. Okay,
Yeah.
never mind. I'll stop. All right. So now.
And that's that's the max. I've seen a lot of guys run on 45 minutes per patient.
Right.
So
All right. So now, next one is assisted hygiene. I know we get asked about this a lot.
we do.
What are the pros and what are the cons of assisted hygiene?
So
Well, first off, you might want to explain it. Some people still ask what it is, but it's kind of a semi-known concept.
yeah, so assisted hygiene is when one hygienist is handling 2 columns of patients with an assistant. So what the assistant is doing is they're seating the patients, they're turning over the rooms, they're taking the x-rays, they're doing everything that they can.
That they're legally allowed to do.
Yeah, that they're legally allowed to do, and the hygienist is just coming in and doing what they need to do under their license.
Yeah, because I've even seen it where in certain states where, I don't know, again, don't take this as legal advice, but where coronal polishing is legal for a assistant to do, they'll have the assistant do the coronal polish as well.
Exactly. And in certain states where that's allowed, maybe assisted hygiene is wonderful.
Sure.
Right. When do people usually do assisted hygiene? They usually do it for one of 2 reasons. One, they can't find hygienists, or the other reason they would do it is they have a hygienist they totally love, and they want that hygienist to see every patient.
Okay.
Right. Those are really the pros.
Okay.
Right. What are the cons behind it? You don't want the hygienist to lose time with the patient, because very often the hygienist is instrumental in presenting dental treatment plans.
Right.
So if you cut that time too short, the time that the patient gets spent with the hygienist, your sales start suffering.
I see.
And since we've spoken about this a lot, since most of your sales should be coming from hygiene, you don't want to do anything that interrupts that.
Okay.
So you can't schedule your assisted hygiene so tight that your sales suffer.
Yeah, it's interesting. So you're trading off potentially more hygiene production.
Yes.
Because if you look at it from a numbers perspective,
Yeah.
instead of paying 2 hygienists,
Yeah.
I'm getting almost the production of 2 hygienists for a hygienist and a dental assistant.
Correct. But if I lose a ton of sales,
Right.
dental sales,
That's what I'm trading.
it's not worth it.
Right. So I'm cranking out the cleanings, but I'm not.
Correct.
Yeah. And that really doesn't account for, like, with periotherapy, there's nothing the assistant can do.
That's exactly right.
So the hygienist is going to be in that room for 50 minutes to an hour just cranking anyway.
That's exactly right. And then the other con is that I'm tying up a second operatory. I could see more patients with 2 hygienists out of 2 operatories than with 1 hygienist and 1 assistant, because there's
There's always going to be a lag.
Yeah, there's always going to be a lag. I'm sorry. 1 hygienist, 1 assistant.
Got it. I was getting confused too. 2, 1. I don't know.
Yes.
Whatever. It makes sense though.
Yes.
It's more effective use of your time.
Correct.
So the pros are more productivity. You can see more patients. The cons are less. So would you, if someone had the choice, like they could have 2 hygienists, or they could do assisted hygiene, which way would you recommend?
The only time I would recommend assisted hygiene is if hygienists were extremely difficult to find in your area.
But let's say if I could find them,
I would always go with two hygienists.
Got it. So you would always pick that over assisted hygiene.
100%, because that patient communication time is so incredibly vital in getting the patient to understand why they need the treatment they need and committing to it. Because very often when the doc comes in for their exam, the only thing they have time for is to sprinkle holy water on something that they had already diagnosed in the past.
With a patient of record.
With a patient of record. Right, so you want that hygienist to have time to review that treatment plan with the patient, and they're part of your clinical staff. I mean, they're great at going over treatment plans.
Which brings me to my next question.
Yeah.
So how important, or the way we phrase this, because we had a couple different ways we phrase this because we get it from clients, which is, should my hygienist help me with treatment presentations? That was one of the ways it was asked, or how much should they help me?
Yeah, absolutely. I mean, ultimately it's the job of the providers, which is your licensed providers are your hygienists and your doctors and, your assistants, obviously, but I'm referring specifically to those two, right? It's their job to advocate for the patient's health.
Sure.
And if a patient walks in healthy and they walk out, or if a patient walks in unhealthy and they walk out unhealthy, even if they're healthier, right? We failed somewhere, right? Our system failed unless that patient was just financially destitute.
Okay.
Right? But in most cases, that's such a rare occurrence. It's usually we didn't make time to sell them. We didn't make time to get them to understand. We weren't effective in our ability to make the patient understand why they needed it. We didn't have enough financial options, right? There's something went wrong when that happens. When a patient is on the hygiene schedule, the most qualified person, and the person that has the most time to do that, to have that discussion, is the hygienist. Now, very often you can get a hygienist on board with having a discussion about their perio needs, right? But they need to be comfortable going over already diagnosed treatment plans as well, right? And very often what I've seen, and I want to make sure that I say this right so that nobody gets the wrong idea.
Sure.
Right? You can see, I have met very seasoned hygienists that were assistants beforehand, right? And they're better at spotting things that the doctor needs to look at than some new graduate doctors.
Sure.
Right? And while they cannot diagnose, they can certainly point out issues that to the patient, like this is what I'm going to have the doctor talk to you about, right? I see a crack here. Now, obviously, we need to get the doctor to confirm this, but if that is cracked, it's going to need a crown, and this is why, right? So we need to be careful in the way that the hygienist presents this. So that
I see why when you said be careful, they can't diagnose.
They cannot diagnose, right?
Me. But there's nothing wrong with, in my view, if a person's missing a tooth,
Yeah.
for the hygienist going, hey, have you ever had thought of having this tooth replaced?
I mean, the front desk could do that.
Yeah. Or, hey, it looks like this crown is loose, or there's a big open margin here, or something like this.
I want the doctor to
I
look
want the
at
doctor
this.
to look at this when they're in here.
Correct. So that when the doctor, who usually has limited time for those exams, doesn't have to start from scratch.
Right. They flag some things they would like the doctor to look at.
Correct. They are a healthcare team. They should be
Right.
working together as a team to get that patient healthy.
Which I guess brings it up to, because we've heard this before. Someone says, yeah, I talked to a hygienist. They said they're happy to clean teeth, but they don't want to help with treatment presentations or treatment acceptance.
Just like a receptionist that won't clean your waiting room. Like, I'll answer your phone, but I won't clean your waiting room. Like, they do half the job.
Or that scheduler we talked about who didn't like making phone calls.
Correct. Like,
Yeah.
I'll answer the phone and schedule the patient, but I won't reach out to patients that are unscheduled. It's like, it's part of the job. You can't
Right.
do half the job.
Well, and also a hygienist is going to, on average, spend more time with a patient than the doctor is.
Yeah.
And even when the doctor is with a patient,
Yeah.
and they're doing some type of procedure, they're in and out of the chair very often.
Yeah.
Or the procedure they're doing isn't very, what's the word I'm looking for, kind of conducive to a conversation.
Right.
You've got a rubber dam in a patient's mouth.
Right. There's not a lot of conversation coming
Right.
back.
With a hygienist, it's not like that.
No.
No.
No, not at all. So no, should the hygienist be part of that financial or that sales discussion? Absolutely.
The treatment presentation, yeah.
Yeah, sales, treatment presentation. I mean, sales. Treatment
it is sales.
presentation. It's a pretty word for sales.
No, I know.
Right. So yeah, I want them to be part of it. Personally, if I was a dentist and I was hiring a hygienist who wouldn't do that, I wouldn't hire him, just like I wouldn't hire an associate doctor that wouldn't have a discussion with the patient about their needs.
Right.
I just wouldn't do it.
That'd be a non-starter for you.
Nah.
Got it.
Yeah, because they need to work together as a team. They only have limited time. So the person that has the time available to do it needs to do it.
Okay. And then how would you recommend? So let's say we have somebody listening and it's a doctor or it's a doctor and a hygienist and they want to get better at that.
Yes.
So that they can, would you suggest that they kind of role play it a little bit, how it would work with a patient or?
Yeah, role playing is always a great thing, right? Especially coming up with the objections that they run into, like how would I handle those objections?
Sure.
Right? Obviously, I'm always going to recommend MGE.
Sure.
Sales seminars.
Sure.
I mean, that is what we teach. The reason why we have a thriving business is because nobody teaches doctors how to sell.
Well, and
so
also,
we do.
It's called the sales and communication seminars. Because
Correct.
really with hygiene, you're not asking hygiene to diagnose and present a treatment plan.
No.
But they're supposed to be sort of like
Effectively communicating.
Yeah, and helping people to notice things.
That's exactly
And
right.
I've seen a lot of cases where the doc walks in, looks at something, and then the hygienist has built up enough of a rapport with the patient where they then turn to the hygienist and go, what do you think?
Yeah.
No, oh yeah, he's really good. You should really do what he says. Or,
Yeah.
I mean, that makes sense.
Yeah.
Yeah. But I'll put a link to the sales and communication seminars on the episode webpage.
I would do that. Yeah.
All right. Well, I think those were the big questions.
Yes.
Yeah. And I think we may come in under our 30-minute mark. Ooh, just close.
Ah.
All right, good.
You know what it is? When just like associates or dentists are not taught the business side of dentistry, which means that if they don't know it, they can't do dentistry because you need to get patients in the chair. You need to get them to pay for their services in order to build a practice.
Sure.
Neither are hygienists. And very often from what I've seen when I've spoken to hygienists, they're being told directly, you should never have a financial conversation with a patient or you should not be going over dentistry. So sometimes it's just a matter of reteaching your hygienist and figuring out a way that they can do it that they're comfortable with.
Yeah, I mean, I guess the finance wouldn't be that critical, but definitely the treatment aspect would be critical,
patients
right?
are going to ask about
That's true. How much
does
is an
that
implant?
cost?
Oh, it's a few $1,000s.
Yes.
Yeah, I could see
They
that.
don't need to work out how to pay for it, but they need to be able to say how much something costs.
No, I agree. They're part of the sales team.
Yeah.
And if somebody has a problem with that, that's probably not an ideal fit.
Exactly.
Yeah. No, I agree.
All right.
Well, Sabri, I think that hits all the questions I had for you.
Awesome.
Thank you so much for joining us this
You
week.
are so welcome.
Super appreciated.
Yes.
Now, if people have any questions about this, do you mind if they email you? I'll put
No,
your
of
email
course
address on the episode webpage. It's
Of course not.
sabrib@mgeonline.com. We'll put a link to it on the episode webpage. You can always email Sabri. We also have the downloads. We just mentioned. I have the free form from Sabri, which is sort of the clinical guidelines for setting up your own perio policy in your practice. We also have the links to the MGE communication and sales seminars. Folks, if you want to know more about MGE, you can always find us online at mgeonline.com or call us at 800-640-1140. I do hope this helps. Have a great week, and we'll see you at the next episode.